Welcome back to the Wellness Way podcast, everybody. Don't forget to like and subscribe so you never miss an episode. And a big thank you to Direct Wellness for sponsoring this episode. Make sure you head over to directwellnessnow.com and use code DW5% for a discount on their awesome medical weight loss programs. I'm Liam, and I'm joined today by Sarah, our expert guide for this deep dive. We're taking a look at some fascinating research hinting at a potential link between semaglutide, a common diabetes drug, and a lower risk of developing Alzheimer's disease.
It's certainly a connection worth exploring. This research from Case Western Reserve School of Medicine dug into the medical records of over 1 million type 2 diabetes patients aged 60 and above. They weren't just looking at anyone with diabetes, though they specifically focused on those who were just starting a new diabetes medication.
So they were looking at people at a kind of turning point in their treatment.
Exactly. The researchers compared the outcomes of those starting semaglutide to those starting 7 other anti-diabetic medications. What makes this study especially compelling is their statistical approach, which essentially mimics a randomized clinical trial.
Can you break down what that means for us? It sounds like it strengthens the research somehow.
It does. Essentially, a randomized controlled trial is considered the gold standard in medical research. It involves randomly assigning participants to either a treatment group or a control group. This helps to minimize bias and ensure that any observed differences between the groups are truly due to the treatment being studied. Of course, in this case, they couldn't ethically randomly assign patients to different medications, especially since these were real-world medical records. So instead, they used a statistical technique to control for various factors that might otherwise skew the results. They carefully matched patients based on age, sex, other health conditions, and even socioeconomic factors.
So they were essentially creating virtual groups that were as balanced as possible to simulate a randomized trial.
That's a great way to put it. And this technique gives more weight to their findings. The results were quite interesting.
And what did they find?
Well, the study found that the folks taking semaglutide had a significantly lower risk of being diagnosed with Alzheimer's disease compared to those using the other 7 medications. Even more intriguing, this difference persisted even when comparing semaglutide to other drugs in the same class, specifically other GLP-1R medications.
For our listeners who might not be familiar, can you quickly explain what GLP-1R medications are and how they work?
Of course, GLP-1R stands for glucagon-like peptide 1 receptor. Essentially, these medications work by mimicking a naturally occurring hormone, GLP-1, that helps regulate blood sugar levels. This hormone also seems to play a role in appetite, and even has some effects in the brain. They've become increasingly popular for treating type 2 diabetes and more recently have been approved for weight management as well.
Right. And many people will recognize semaglutide as the active ingredient in those very popular weight loss medications, Wegovy and Ozempic. It was initially approved for type 2 diabetes, and its weight loss effects have definitely been making headlines. But this connection to Alzheimer's risk adds a whole new dimension to the conversation.
Absolutely. To fully grasp the potential impact of this finding, we need to consider the sheer scale of Alzheimer's disease globally. Over 55 million people were living with dementia in 2020, and that number is projected to rise dramatically as the population ages. In the U.S. alone, nearly 7 million people aged 65 and older have Alzheimer's. It's the 7th leading cause of death in the country.
And sadly, as many of our listeners know, there's still no cure for Alzheimer's. The FDA has approved a couple of new medications, Leqembi and Kisunla, but these are very expensive and only appear to modestly slow the progression of the disease. They target amyloid plaques in the brain, which is just one aspect of this complex condition. So any new avenue for prevention or treatment could be a game changer.
It really could be. And what's fascinating here is that the researchers emphasize how both type 2 diabetes and obesity are modifiable risk factors for Alzheimer's. We already know that semaglutide is effective in managing these conditions, but this study suggests it might do even more.
It makes you wonder what other hidden benefits this medication might have, doesn't it? We focused a lot on Alzheimer's, but the researchers pointed out that semaglutide has shown promise in managing other conditions that are also linked to an increased risk of Alzheimer's, things like cardiovascular disease, alcohol use disorder, smoking, and even depression.
You've hit on a crucial point. It seems like semaglutide may be exerting a beneficial effect on multiple systems in the body, some of which may be indirectly linked to brain health.
So potentially semaglutide's effect on Alzheimer's risk may not even be a direct one.
That's one of the big questions researchers are grappling with. It's a very complex puzzle. While the results of this study are encouraging, it's crucial to remember that this is an observational study. It highlights a potential link, but doesn't definitively prove cause and effect. As the authors themselves acknowledge, further research is needed, specifically large-scale randomized clinical trials to really confirm whether semaglutide can actually prevent or treat Alzheimer's disease.
That's a crucial point. We don't want to give anyone false hope. But at the same time, this research is definitely opening up a whole new avenue for exploration, and that's exciting. This is a field we'll be following closely.
It certainly is exciting. This research has definitely generated a lot of buzz in the scientific community. It's not every day that we see such a potential connection between a medication already widely used for other purposes and a devastating disease like Alzheimer's.
It's like we've stumbled upon a new clue in a very complex mystery. But beyond the excitement, what are some of the key takeaways you've gleaned from all of this research, Sarah? What's the so what for our listeners?
That's a great question. I think one of the most important takeaways is that this research reinforces the crucial role lifestyle factors play in our overall health, including brain health.
That's a theme we often talk about on the show, but it's definitely worth repeating.
Absolutely. Managing conditions like type 2 diabetes and obesity isn't just about physical well-being, it's potentially about protecting our cognitive function as well.
Yeah.
And this study suggests that semaglutide, which has already been proven effective in managing those conditions, might offer benefits beyond what we initially thought.
So it's not just about losing weight or controlling blood sugar levels. It's about potentially protecting ourselves against a disease that robs people of their memories and independence. That's a powerful concept.
It is. But it's also crucial to remember that this study is observational. It highlights a potential link, but doesn't definitively prove cause and effect. We still need those large-scale, randomized clinical trials to confirm whether semaglutide actually prevents or treats Alzheimer's.
That's a really important point. We don't want to give anyone false hope, but at the same time, this research does open up a whole new avenue for exploration, and that's what's generating so much excitement. It's like a signpost pointing us in a new direction.
Exactly. And who knows, maybe this will lead to a breakthrough in our understanding of Alzheimer's and how to combat it.
It's definitely got the scientific community buzzing. But let's shift gears a bit and talk about the practical implications for a moment. Let's say those clinical trials do confirm semaglutide's effectiveness against Alzheimer's. What could that mean for people living with the disease or for those who are at risk?
Well, if further research confirms these findings, it could potentially revolutionize how we approach Alzheimer's. Imagine a future where we have a safe and effective medication that not only manages diabetes and obesity, but also significantly reduces the risk of developing this devastating disease. That would be a game changer.
It'd be incredible.
Think about the impact on public health. If we could prevent or delay the onset of Alzheimer's in a large portion of the population, it would significantly reduce the burden on healthcare systems and improve the quality of life for millions.
And on a more personal level, it would mean families wouldn't have to face the heartbreak of watching their loved ones succumb to this terrible disease.
Precisely. It would be a tremendous victory for individuals, families, and society as a whole. But of course, we need to proceed with caution and let the science guide us.
Absolutely. But it's hard not to get excited about the possibilities. So what should our listeners be doing with this information? Should they be rushing out to get a prescription for semaglutide?
Not so fast. It's important to remember that semaglutide is a prescription medication with potential side effects. It's not something to be taken lightly, and it's definitely not for everyone.
Right. It's not a magic bullet.
Exactly. Anyone considering semaglutide should consult with their healthcare provider to discuss whether it's appropriate for their individual circumstances.
That's really important advice. Always talk to your doctor before starting any new medication or making significant changes to your health regimen.
Absolutely. And in the meantime, let's not forget about those modifiable risk factors we discussed earlier. Maintaining a healthy weight, managing blood sugar levels, eating a nutritious diet, getting regular exercise, not smoking, and limiting alcohol consumption. These are all steps we can take today to potentially reduce our risk of developing Alzheimer's.
Those are all great points, and they reinforce the message that we have a degree of control over our health destiny.
Exactly. We're not simply passengers on this journey. We can make choices that support our overall well-being, both physically and cognitively.
Empowerment through knowledge and action. That's what we're all about here at The Wellness Way. Speaking of action, what are some things listeners can do right now to learn more about Alzheimer's and stay informed about the latest research?
That's a great question. There are several reputable organizations dedicated to Alzheimer's research awareness and support. The Alzheimer's Association, the National Institute on Aging, and the Alzheimer's Drug Discovery Foundation are all excellent resources.
We'll be sure to include links to those organizations in our show notes. Anything else you want to add before we move on?
Just a reminder that this is a rapidly evolving field. New research is emerging all the time, so staying informed is key.
I couldn't agree more. Welcome back to the Wellness Way podcast. We're wrapping up our deep dive into the potential link between semaglutide and a reduced risk of Alzheimer's disease. Sarah, we've talked a lot about this specific study, but I'm curious to hear your thoughts on the broader implications. If semaglutide does prove to be effective against Alzheimer's, how could that impact drug development and research for other neurodegenerative diseases?
That's a fantastic question. And you've hit on a really crucial point. If semaglutide's effectiveness is confirmed, it could potentially open up entirely new avenues for treating a whole range of neurodegenerative diseases. We're talking about conditions like Parkinson's disease, Huntington's disease, amyotrophic lateral sclerosis, ALS. The possibilities are vast.
So this could be a turning point in how we approach these conditions, almost like a paradigm shift.
Potentially, yes. Right now, many of the treatments for neurodegenerative diseases primarily focus on managing symptoms. They don't necessarily address the underlying causes of the disease. But if semaglutide demonstrates a protective effect on the brain, it could shift the focus towards preventing or delaying the onset of these diseases altogether.
That would be revolutionary. It would be a huge step towards a future where these devastating diseases become manageable chronic conditions rather than debilitating and ultimately fatal illnesses.
It's certainly a hopeful prospect. And what's particularly exciting is that semaglutide belongs to a class of drugs, the GLP-1 receptor agonists that are already being studied for their potential benefits in other neurological conditions. So this research could provide further momentum for those investigations.
So we're potentially talking about a ripple effect across the entire field of neurology.
Precisely. This one study could have far-reaching consequences, sparking innovation and driving research in ways we can't even fully imagine yet.
It's incredible to think about the possibilities. But let's bring it back to the individual for a moment. What advice would you give to someone who's concerned about their own risk of developing Alzheimer's? Maybe they have a family history of the disease, or they're just starting to notice some cognitive changes. What would you tell them?
That's a question I hear quite often, and it's completely understandable that people are worried. First and foremost, I would say don't panic. There are many things you can do to support your brain health, even if you have a genetic predisposition to Alzheimer's.
So it's not a foregone conclusion.
Absolutely not. While genetics do play a role, they don't determine your destiny. Lifestyle factors, as we've discussed, can have a profound impact on your cognitive function.
Okay, so let's break that down a bit. What are some practical steps people can take to reduce their risk?
While many of the recommendations we've already mentioned apply, maintaining a healthy weight, engaging in regular physical activity, eating a nutrient-rich diet, getting enough sleep, managing stress effectively, and staying mentally active are all crucial.
So it's about taking a holistic approach to health and well-being, thinking about the mind and body as connected.
Exactly. Your brain is part of your body, and it thrives when your body is healthy, so taking care of your physical health is essential for cognitive health as well.
That makes perfect sense. And on the mental stimulation front, what kinds of activities are particularly beneficial?
Anything that challenges your brain and keeps it engaged is great. Learning a new language, taking up a musical instrument, playing brain training games, reading, writing, doing puzzles, even just socializing with friends and family, all of these can be beneficial.
So it's about staying curious, keeping your mind active, and having fun.
Precisely. Challenge yourself. Learn new things, stay connected, and enjoy the process.
Great advice. And just to reiterate, if you're concerned about your cognitive health, it's always a good idea to talk to your doctor. They can help you assess your risk factors, rule out any underlying medical conditions, and discuss strategies for supporting your brain health.
Absolutely. And remember, early detection is key. If you notice any significant changes in your memory or cognitive function, don't hesitate to seek medical advice.
That's a great point, Sarah.
Yeah.
And on that note, I think we've covered a lot of ground today. We've explored the potential link between semaglutide and a reduced risk of Alzheimer's, discussed the broader implications of this research, and provided some practical advice for supporting brain health.
It's been a fascinating conversation, and I hope our listeners have learned a lot as well.
I'm sure they have, and we'll be sure to keep you all updated on any new developments in this exciting field of research. Thanks for tuning in to the Wellness Way podcast. Don't forget to like this episode and hit that notification bell so you don't miss any of our future deep dives into fascinating health and wellness topics. And if you're enjoying the show, please consider subscribing. We'll be back next week with another exciting episode.